Hello students, welcome to Legacy Academy. In today's video, we are going to discuss about a recent outbreak of GBS, also called as Guillain-Barré syndrome, which we have seen in the Pune, a city of Maharashtra, where more than 100 cases suddenly of GBS has been recorded, which is one of the significant outbreak or one of the highest extent of outbreak that we have seen in the recent future in not only India but across the entire world. So if we try to understand that what has happened recently, so the city municipal corporation of Pune, it has tested the water sample because of the sudden increase in the outbreak of the cases of GBS, and while testing they have found that at least 15 private tanker services in the city are allegedly contaminated by pathogens that might have to some extent created the outbreak of GBS. Also, the Pune Municipal Corporation has introduced a series of measures to ensure clean and safe water for its citizens in the light of recent GBS cases. For example, it is also creating awareness that people should only use chlorinated water in their home. The administration has been testing water samples from various sources such as borewell, such as from the tankers, such as from the, we can say, nearby dam supply, river water supply, and overhead tanks, beside examining the tap water in the localities where the outbreak has been witnessed. Now, if you look at the outbreak itself, it is not the worst GBS outbreak in the world yet. However, it is one of the significant outbreak. The reason is because as per as the World Health Organization and medical literature is concerned, they classify that if there are cases more than 30 to 50 in the number, it is akin to having an outbreak. And we know that in the case of Pune, around 118 cases have been recorded so far. Also, if you talk about the worst flare up or the worst outbreak of this disease, it was seen in 2019 in the South American country of Peru, where about 1120 cases recorded were in the single year. Out of that, 683 cases were recorded in just 2 months. So after Pune, we can say in the recent time, this is the worst outbreak. Now, what is the reason behind the GBS or Guillain-Barré syndrome? Now, it is believed by the medical community that the disease is a kind of autoimmune disorder. Now, what is autoimmune disorder? We know that our body has a functioning immune system that helps us protect against any kind of foreign invasion, foreign agents such as bacteria, viruses, or any kind of diseases. But sometimes this immune system considered your part of body itself as a threat and start attacking it. So when your immune system start attacking your body and damages your peripheral nerves, what results is the Guillain-Barré syndrome. Peripheral nerves basically are those nerves which are situated in your arms, hands and legs, and it carries the signal from your brain to these part of body for a response. Now, a group of similar diseases affecting various part of different nerves are collectively called as GBS or Guillain-Barré syndrome, which is further classified into two major types. The first type of GBS is what is referred as AIDP, that is acute inflammatory demyelinating polyradiculoneuropathy. In AIDP, the immune system attacks the myelin coating or myelin sheath of the nerve. We know that inside our body, when we talk about the nervous system, nerves are not naked, rather they are covered by a protective layer of myelin sheath. And when this protective layer of myelin sheath is attacked and damaged by the immune system, the disease is called as AIDP, which is a variant of GBS. The second disease is acute motor axonal neuropathy, or called as AMAN, or acute motor sensory axonal neuropathy, AMSA. In this case, the immune system body does not attack the protective covering but directly attacks the nerve itself, which is referred as the axon. So these are the two variants that we have seen today. Now, as far as the GBS is concerned, I told you that in our body we have the nervous system that is carrying the signal from different part of body to the brain, and then from the brain to different part of body. So if you look at the nervous system of a body, we have nerve system that is extending to the arms, then further to the hands, different part of hands, then to the legs. So this part of the nervous system is what we call as peripheral nervous system, which is damaged in this particular disease. Now here what happens, as we have talked about, the myelin sheath or layer, it insulates the nerve of your body and allows the electric signals to travel along it in a very quick manner. So when the sheath itself, the myelin layer itself is damaged by the immune system, the signals from your brain do not travel along your nerve pathways properly, and that creates a lot of problem and lot of symptoms. Now let us try to understand this in more detail. We know that the Guillain-Barré syndrome is something The exact cause, how it happens, we do not know. We just know that it is an autoimmune disorder. It happens due to the attack of immune system body on the body itself. So the exact cause is unknown, but most people who develop it have had some sort of infection. This is a common pattern we have seen both in the recent outbreak as well as in the earlier outbreak as well. For example, many people who have suffered GBS few weeks before developing the symptoms of GBS, they have shown the symptoms of food poisoning. For example, in the case of especially Campylobacteria, that is a type of bacteria which is common in Aotearoa, New Zealand, where the GBS outbreak has been recorded. Apart from food poisoning, some symptoms related to flu have been recorded in the patients. Apart from that, a viral infection can also trigger GBS. For example, HIV, or you have glandular fever, or you have cytomegalovirus, or recently the world has seen spread of epidemic pandemics such as COVID-19. So as an after effect of COVID-19, GBS has also developed in many of the affected patients. So this is a common trend that we have observed. So these are the most common regions or infections that precedes GBS. However, also we have seen other common symptoms which are relatively less common, such as tropical diseases like dengue, Zika virus. These can also cause GBS in the future, or surgery or trauma and bone marrow transplant. So in rare cases, these also have been known to cause Guillain-Barré syndrome in the patient. Now, fortunately, one thing we can be sure about, that GBS is not a hereditary disease. That means if your father, or if your parents or grandparents have GBS, it does not mean that you will also be prone to GBS. On the other hand, it is also not infectious or contagious. That means you cannot get GBS from someone even if you come in contact with that person. For example, if you are sitting near a person infected with GBS, you can be sure that it will not affect you as well. So neither infectious nor contagious nor hereditary nature. This is something that we can see in a positive light. Now, if you look at the overall symptoms of the GBS, it is first of all the gastrointestinal system in the case of Pune has been affected in many patients, where they have suffered from nausea, vomiting, diarrhea, stomach cramps and all that. But apart from that, as I told you, that in the GBS, immune system damages your peripheral nervous system or peripheral nerves, and that is why weakness and tingling in your extremities, that means in your hands and your legs, is the first symptom associated with GBS. Gradually, as the symptom progresses and the disease progresses, you can even feel weakness in the limb. That means you will not be able to walk properly. You will not be able to hold something properly in your hand. You might have difficulty in the swallowing this process. You might also experience shortness of the breath if the lung related nerves are being affected, or the flaccid paralysis also we can see from here. And the reason is, again, if you try to look, if I told you that we have a nervous system, so nerve fiber we can see is having a protective coating of myelin sheath in this case. So this is how a healthy nerve look like. Now suppose if a person is affected by the GBS, in that case we can see the nerve coating has been damaged here and there, the myelin cover has been damaged here and there, that exposes the nerve fiber, and this causes problem in the conduction of the electric signal, and also it makes the hand and the legs or limbs we can say more and more sensitive in nature. That means even if you touch something by accident, it will feel that you have touched a kind of electric wire, you will feel a kind of shock, you will feel a kind of tingling like sensation. So that is the overall impact of the GBS. Now the question that might come into your mind, that is the disease curable? Now unfortunately, till now the medical communities or the scientists have not been able to discover any cure for the Guillain-Barré syndrome. So how the patient are then this we can say managed? So obviously the treatment largely that is associated with this particular disease focuses upon the managing of the symptoms, and also in ensuring that people are able to recover, the patients are able to recover in a short period of time. So medical management is done through several therapies. The most notable one are the plasmapheresis, where the plasma is separated from your blood. Then other is immunoglobulin therapy, where the immune system is directly targeted, and this overall help people in not getting affected by the virus and bacteria in the near future. Apart from that, physiotherapy also plays a large role throughout the entire progression of the Guillain-Barré syndrome. So as we can see, largely the medical intervention is for the management of symptom, for allowing the people to recover at a faster rate, not in the treatment of disease itself. Now if you look at the Pune case itself, What can be the possible reason behind the sudden outbreak? So several factors can be there. As we have discussed, that Guillain-Barré syndrome is preceded by the infection, which can be viral infection or bacterial infection. So in case of Pune, largely experts believe it is because of the infection of water, drinking water, that might have created such kind of outbreak. And in this context, also the civic society, Pune civic society have noted that there has not been cleaning of water tank by household for many years, many months, that might have created the infestation of bacteria. Apart from that, the consumer in Pune have been mixing borewell water with the water supplied by the civic body. That might also have created infection either from one pool of water to the other pool of water. Third, increasing urbanization to some extent is also responsible, because you know that due to the continuous increase in the population in the urban centers of India, the pollution level has increased significantly. And this pollution is also being seen in the Kharakwasla Dam in Pune, where water is largely taken out from and supplied to different part of the city. So the source of water might also have been impacted, affected, or become polluted because of the increase in urbanization. Plus, people are also generally lacking the awareness, because even after the outbreak of disease, we talk about the Pune Municipal Corporation. They have asked the people, citizens, to send the water sample for testing to check that whether there is any threat of any bacterial infection or viral infection or not. But there was not much of an increase in the water samples submitted for testing. So people also are witnessing, or what we are seeing among people is a kind of lackadaisical approach. So these all have contributed to the rise of infection and a consequent increase in the GBS. Now, if you look at the Pune and Peru case and try to have a relation between them, because I told you that Peru recently has seen the most worst, or I can say world's worst outbreak as far as the GBS is concerned. Now, we do not have a lot of linkages as such. The only common link that scientists have been able to found between both the cities is the microbe Campylocter jejuni. This is a kind of pathogenic bacteria that is commonly associated with the poultry and is also often found in the animal feces. And suppose through some method, if animal feces found its way in the water supply, then the bacteria can also be transported in the water supply, and then once you consume it, you will be prone to having this disease. So smaller studies from across the world have shown that this Campylobacter jejuni infection is linked with higher disability as well as higher mortality rate. On the other hand, where the Campylobacter jejuni is not involved, general mortality rate from the GBS is around 5%. So in the case of this bacteria, the mortality rate significantly climbs up. Now GBS has in India, as far as the GBS is concerned, has been always a very rare disease. That is why we do not have any autonomous and dedicated research that has been conducted on this particular disease. So India, if we talk about, if you look at the annual infection or incidence rate, it has been 1.75 to 2 per lakh population. So this is the overall case about the India. Now apart from India, also if you look at the other country, that is Japan, where researchers have found that it has the highest prevalence rate of GBS. It can be due to multiple factors. First, it can be due to the high frequency of infections that is witnessed in the people of Japan. Apart from that, genetic and environmental predispositions might also have made them more prone to acquire GBS. Now, higher exposure to potential causes such as microbe Haemophilus influenza, cytomegalovirus, Zika virus, and respiratory or gastrointestinal infections could be another reason for the increase in the cases of GBS in Japan, and this might also be in the case of recent outbreak that we have seen in the Pune. So that is how we can understand the entire Guillain-Barré syndrome. What is the syndrome all about? What might be the reason behind this, and what is the overall symptom and treatment? So if you like the video, please hit the like button, share it with your fellow aspirants, as well as subscribe to our channel for more such helpful content. Thank you very much.